Good morning. It is 9 a.m. on Saturday, February 24th, 2024. So, yeah, these are my new glasses. Okay, now let me start off with coffee for those of you who are just watching this for coffee, and then I'll get into the glasses, okay? So, I decided that I had gotten a bunch of the raspberry coffee from Nespresso, and I've been saving it. And I thought, you know what? I'm going to go ahead and start drinking it because I was thinking, while I enjoy it, let me really enjoy it. My tastes have been known to change, but I don't know, I think I've liked the raspberry over the last couple of years it's been out, or the year, I don't know. So I figure I'll probably still keep liking it, but I was thinking of this Irma Bombeck quote. If you haven't read any books by Irma Bombeck, especially if you're a mom, you've got to read some. And she said, think of all those women on the Titanic who waved off the dessert cart. So, in other words, live life and enjoy it while you can. So that's what I've decided to do. So I've got a few ounces of almond milk here. I don't know, maybe there's 3 ounces. It's 30 calorie per cup almond milk. And just for good measure, I'm going to richen it up a little bit with some half and half. Okay. There we go. Ah, I can smell the raspberry. Wonderful. Okay. I'm going to kind of keep an eye on it in back of me there through my phone screen, so hopefully I won't get distracted in case it starts to run over. Alrighty. So this is why I have glasses. I had cataract surgery back in June of 2023. And at first, my vision was incredible. But everything adjusts in your eyes to having those new lenses, and your brain has to adjust. And I did have an astigmatism before the surgery, and they do try to correct as much of the astigmatism as they can, but they weren't able to correct it completely. So what happened is, in the past few months, have been having headaches and eye strain and feeling kind of disoriented sometimes. And I thought, oh my gosh, what is wrong? And when I went to have my eyes checked, I was telling the doctor about it, and he said, the reading glasses, plain reading glasses that you're using that just magnify stuff, cannot correct your astigmatism. And also my eyes were seeing just a tad differently, but that meant they were always kind of trying to focus, to get things in good focus. Well, he said that this is not at all unusual when you have an astigmatism. And astigmatism is when your cornea is not completely, perfectly curved as it should be. So it affects how the light comes in. And what you need to correct it is actually, it's like they take two different lenses that instead of them both being oriented the same way, one is slightly turned and they sort of fuse them together. So they not only make the lens to magnify, like a lot of glasses do, to bring things, closer, further away, whatever, but they make it so it's bringing that image into sharper focus. So these are the new glasses I got. Okay, I don't know who Gwen Stefani is, but that's what it says on the glasses. And this was at least an intermediate priced frame, because apparently Medicare will pay for a frame, but they have this, rack of Medicare glasses. Some of them are, kind of nice looking. They're very basic, but the thing is, the quality of the frames is not such that it would stand up to getting whacked in the head by my grandchildren, little babies and stuff. Oh, good. And, you know, I mean, like yesterday, I was sitting with the 4-year-old, and she was sitting right next to me, and I don't know what she was doing, but she went and just whacked me right smack in the eye. You know, I hadn't started wearing my glasses yet. I started this morning. And I can see where I got hit in the eye. Anyhow, so, you know, I didn't want to have a cheap pair of glasses that was going to break under that sort of assault. So anyhow, yeah, so the doctor said start wearing them in the morning before your eyes are accustomed to, you know, using readers or anything like that. So that's what I'm doing. These are progressive lenses. The top, they have no line. You've probably seen bifocals with lines. You know, these are trifocals in a sense. They are no magnification on top, but astigmatism correction is there. Then the middle part is for middle distances, and the bottom part is for close-up. So the top, you know, I can see just like I didn't have glasses, except it corrects my astigmatism, so I can see more clearly. Now, why was I getting headaches and all that kind of stuff? Well, during the day, I do so much switching between looking far and working close and middle distances. You know, like I'll be sitting watching birds through my window, but then maybe I'm reading something, or I'm working on my laptop, or maybe the TV is on. So I'm always switching. And I had multiple pairs of readers. Some of them were bifocals, some of them were progressives, some of them were just plain magnifiers. And it was making me sick, always, you know, changing my vision and looking in different places and stuff. You know, it's a little bit like, have you ever tried on somebody else's glasses and you go, whoa? It was a little bit like that. So far so good with these. I have to get, the reason I have to get used to them is I need to learn, you know, where to put my head, where to put my eyes. So I'm looking through the proper part of the lens. Sometimes when people get progressive lenses, when they need much more correction than I do of my vision, which I don't need very much. It's mostly the astigmatism that needs correction. But when people need, you know, regular kind of glasses, but they get progressive lenses, usually the first maybe week or sometimes 2, they have to be careful, say, walking downstairs, for example, because if they look through the bottom part of the lens, it's going to look like the stair step is at a certain level. They look through the middle or the top, it's going to make the stair appear at a different level, you know, and you can end up miscalculating where you put your feet and trip and fall. With this, it wouldn't be it wouldn't be like that, because the magnification level is nowhere near what it would be for normal vision corrections that most people who wear glasses have. Anyhow, so, oh, this is lovely. So listen, remember all those women on the Titanic who waved off the dessert cart, and enjoy life while you can. Okay. Have a great day.